So we're going to demonstrate the use of Restylane and lip enhancement now. And this is a young woman in her early 30s, and she's a great example of where a small amount of enhancement will have a really nice, significant impact on the look of her lips. She has a nice lip shape. She has a little bit of asymmetry. I definitely want to improve this lower left here, but I want to enhance her lips. But she's a great example of the fact that the middle of her lip is nice, maybe a little bit of enhancement, but her lip tapers off quite quickly, and it makes her lips look short or more narrow. And her oral commissure, if I can widen this out a little bit, it'll give the illusion that her lip is actually wider, and we'll put her oral commissure more in line with her mid-pupillary line. So I think she's going to get great improvement, and I think she's going to be very happy with some subtle lip enhancement. So the first thing I'm going to do on her is I'm going to enhance her upper lip on her right-hand side, and I really want to try to widen this area and put a little bit of volume in the red of her lip here. So what I'm going to do is I like to turn her lip open a little bit, and I'm going to put a little needle in the very corner on the count of 3, 1, 2, 3. And I'll place my needle right under the mucosa, and I'm slowly going to inject, and here I'm going to use anterograde linear technique. So I'm injecting slowly and letting the product go ahead of my needle. I'm going to put a little bit more in. I put maybe 0.1 cc in. You can actually see the product moving in ahead of my needle there. The next thing I like to do is I like to grab the lip, feel it, make sure it's nice and even, and I can blend it or massage it a little bit if necessary to make sure I'm getting the amount that I want in a nice uniform manner. Can you open your lip just a tiny bit? When I look, I can see I don't have quite enough at the very lateral edge of her lip, so I'm going to add a little bit more back in that one location and put a little bit more product in. This becomes more of a serial puncture technique, but now I can see I've been able to widen that lip there. So right now I've injected 0.3 cc's of Restylane on the right side of her upper lip, and I see that I have nice augmentation. I'm giving the illusion that her lip is a little bit wider there, and I'm going to try to achieve the same on her left side. So the first thing I like to do, again, isolate that lip, hold it and get it in a nice stable position, and I'm going to inject a little bit of Restylane on her left upper lip. I'm going to enter right into the red or body of her lip, and I'm going to slowly inject in a linear fashion, but anterograde, meaning I'm letting the product advance ahead of the needle, and I've put in about 0.1, a little more than 0.1 cc there. I'm going to put a little bit more in towards the midline or her cupid's bow. And then, like on the other side, I know I'm going to need a little bit more in this corner, so I'm going to come back and do a serial puncture and really try to lift up and out that upper lip. And sometimes I'll need to put a little bit in the vermilion border on that side or both sides if it's not well defined. I think we have achieved a nice correction on her lip. I think a little bit more just by her vermilion border here, just to help define it. I'm going to use a retrograde technique. I'm in her vermilion border. I'm going to inject a very small amount as I withdraw. And I think I've achieved a very nice balanced upper lip. Now when we look, we see that her upper lip is a little bit bigger than her lower lip right now. So we definitely have to augment or enhance the lower lip to make sure we have good balance and harmony between our upper and lower lip. So now we've injected some Restylane to enhance this woman's upper lip, and now let's look at the lower lip. There's a couple issues that we need to deal with on the lower lip. One is I definitely need some augmentation. I've augmented her upper lip, which was smaller than her lower and now is larger, so we need to make sure the bottom lip is a little bit larger than her upper. Something easy to do. The next thing, which is a little more difficult, is that if you look, she's a little more rounded and a little more fuller on her left side than her right. So I definitely need to try to bring that right side out as much as I can to try to balance that. And then I would like to fix the oral commissures, if I can get them up a little bit. She did mention to me in her consultation that sometimes people think she looks sad and that she's frowning. And that's the resting tone of her muscle, and by letting and the resting position of her oral commissure. If I can lift that up and improve that, that will have a dramatic impact on her and how her lips look with this lip augmentation. So let's try the lower lip first, and let's deal with the oral commissure first. So the first thing I'm going to do is I'm going to try to lift up this oral commissure. I achieve that in two ways. One is I'm going to fill this valley in here where the oral commissure is, and the other I'm going to inject along her vermilion border on that side to roll it out a little bit. So let's do this first. There's going to be a little bit of Restylane in this oral commissure. I put a little bit of product in, I'm just under the dermis, and I'm going right up to the vermilion border, trying to push that vermilion border out. I find it very important to go back into this corner and make sure that I augment a little bit right along the vermilion, right in that very corner of her mouth. And that usually will help lift the corner. And if it's lifted a little bit more than neutral, don't worry, they're going to relax down. There's a little bit of swelling or edema in there. The next thing I'm going to do is I'm going to try, by injecting her vermilion border here, to roll out the right side of her lip to try to make it a similar roundness to the left side. So let's do that. I'm going to use a linear retrograde technique for this. I'm going to enter her vermilion border in the corner. I'm going to put my needle along that vermilion border, and I'm going to slowly inject product as I withdraw. And I'm going to probably end up putting a little more on this lower right side than her left, because I want to try to make that lip line as close as I can, or if I can achieve even a little more than her left, I'll just augment her left side to match. So far that's good. I can see it's definitely coming out, but I don't have enough in there. I've created a vermilion border. Now I want to augment this part of her lip, which is between her wet-dry border and her vermilion border, or wet-dry junction and vermilion border. I'm going to use a serial puncture technique here. I'm going to go in and I'm going to slowly inject about 0.1 cc, about another 0.1 cc, just to try to bring that out a little bit. I'm going to try to get this lip as good as I can first, this side, because I don't want to find that I haven't been able to get it out enough and then I took out her left side too much. So I want to get her right side as good as I can, and then I'll go and match her left side to it, because this is going to be her more difficult side. See, I can still bring a little bit more on the vermilion edge here, and I think that's a lot better. So I'll now stand back and have a look at her lip, and I think I've got some nice improvement there. It's definitely closer to the other side, so I'm going to subtly try to put some more on her left side. Then what I'm going to do is I'm going to look at the middle of her lip, and I'm going to try to give her a little bit of a pout. Very common amongst young women wanting their lower lip a little bit more pouted if possible. They like the appearance of that, and I like to do that at the end. So I'll be putting some product to augment that and to roll it out a little bit. So let me go to her left-hand side and put a little bit on her left vermilion and her left lower lip. So I'm just looking now. I see I've achieved a closer roundness of her right lower lip to her left. I'm just going to leave her vermilion here. I'm going to put a little bit of product in this left lower lip. Not too much, because I don't want to overcompensate, because I may not be able to get her right side augmented as much, because naturally that right side was smaller. I think we're pretty balanced. A little bit more on her bottom right will make it a little bit more even. It's definitely looking better. I do need to put a little bit into her oral commissure on her left side. So let's lift the corner up on her left side as well. Again, I'm pushing the product right up to the vermilion border there. So I think we've achieved some improvement on her lip. They look a little bit wider. They look definitely more symmetric and more balanced. And let's try to give her just a little bit of pout of her lower lip and see if we can roll that down a little bit. I find the best way to do that is to look at her lip. You can almost get the illusion that there is a Cupid's bow on the lower lip. Usually there's a little bit of a point in the center where the lip comes from. And if I stay above that, closer to the wet-dry border, and put two little injections in there, I find that will protrude out the lip and maybe give a little bit of a pout to the lip. I like to use a serial puncture technique, pinch the lip, put a little bit of product in, maybe 0.1 on both sides. And you'll see what that does is it gives a little curve to the lower lip, almost like a vermilion border to the lower lip, and helps pout out the lower lip, which can be very popular, especially amongst younger women. So let's take a close look and see what we've achieved so far. I think we have really nice balance. We have the upper lip a little bit smaller than the lower lip, around the 1/3, 2/3 ratio. I'm very pleased with the definition of a vermilion border, the size and shape of the lips. They look very good and balanced now. If I look from a wider point of view, I can see that when I'm trying to check her oral commissures, I see the corners are up now. They're in a great position. And I've been able to achieve a wider appearing lip. Her lip sort of ended here before, but now it ends about here. When she's looking straight ahead, well, that's pretty close to bang on to her mid-pupillary line. And these are really nice, balanced lips now and very proportionate for her face. So I'm very pleased with the overall look. When I'm happy, and I think when I make patients happy, is when I'm able to achieve a lip that doesn't look done. It looks like it fits in proportion to the individual coming in. It's not too big for their face. It's not too wide for their face. It's not noticeable in the sense she has nice lips, but no one's going to notice that her lips are done. They just look like they've been enhanced subtly, and it's enough that she notices a difference to make her happy, but no one's going to see her and stop her on the street and say, oh, you've had your lips done. And that's typically, in my opinion, what can be achieved with some subtle changes with Restylane to give some nice subtle lip enhancement. Typically what I tell patients is that it can take up to 2 weeks to really completely settle down if you have a small adverse event like some swelling or bruising. So I tell patients to just observe. Some of the swelling will go down. Most of it will go down rapidly over the course of a day or two, but small amounts of bruising or redness can last up to 2 weeks. And reassure the patients that that is a common thing to see and that you can always see them back at any point to reassure them during that time.